Well, hello everyone and welcome to today's webinar. My name's Yeshua and I'm the Outreach and Social Media Coordinator for the Canadian Cancer Survivor Network. On behalf of CCSN, I'd like to thank you for attending today's Cancer Can't Wait Virtual Action Week webinar. This is the first in a three-part series we'll be doing where we'll be talking to a panel of advocates that have joined us in our meetings with elected officials to share their stories and experience with cancer and the healthcare system throughout the COVID-19 pandemic. If you're new to one of our webinars, let me just take a moment to give you a brief overview of our organization. The Canadian Cancer Survivor Network, or CCSN, is an organization working with cancer patients and survivors to learn about the complexities of our health system, connect with others, to plan action and act on those plans to promote better healthcare and healthier survivorship. If you'd like to learn more about CCSN, please visit our website at www.survivornet.ca. You'll find plenty of information there on us as well as news, events, and other resources that we think you'll find helpful. Before we begin, I have two quick announcements and then we'll jump in. This webinar is being recorded and it will be available tomorrow on YouTube. The video link will be sent to the email you provided when registering, so you can share this resource with others, or you can go back and watch it again if you'd like. At the end of our presentation, we'll also have a short Q&A session. However, don't feel the need to wait until the end. You can use the questions window in your screen that you can submit questions the entire time and we will have them queued up for the Q&A at the end. But now it's my pleasure to introduce our panel for today. We have Andrea Redway, who is a lawyer based in Ottawa, Deborah Peniuk, who is owner of a health and wellness focused niche travel company, A Life, as well as an avid patient advocate, speaker, writer, certified laughter yoga leader, which is probably my favorite one of all of her positions, but also holds many positions at nonprofits and charities all over Ontario. As well, we have Jennifer Roy, who as well is an avid advocate for lung cancer awareness. And facilitating today's webinar, we have CCSN's own Public Policy Analyst and the man spearheading our meetings with politicians across the country, Conrad Eder. And so over to you, Conrad.
Yeah, thanks so much. And thank you all very much for joining us today. It's my privilege to be joined by a phenomenal panel of advocates to present today on behalf of CCSN our Virtual Action Weeks East edition. As Yeshua pointed out, this is part of a series of webinars that we're going to be conducting over the last several months. The Canadian Cancer Survivor Network has been having virtual meetings with elected officials all over Canada. It would be quite a task to try to include all of those in one webinar, so we've split it up into a few. Today we'll be focusing on Canada East, and it'll give us a chance to highlight our meetings in Ontario and Atlantic Canada. For today's webinar, I've broken it down into two sections. First, I'm going to start off talking a little bit about our COVID-19 and cancer care survey. For many of you who may have been keeping up with CCSN over the last couple of years, our COVID-19 and cancer care survey has been really the catalyst for our virtual action weeks. It's been providing us an opportunity to bring the latest research and evidence and advocacy directly from cancer patients to better understand how the pandemic has impacted their lives. I'll be taking a few moments to highlight the key findings of that survey, and then in line with today's presentation, focus on Ontario and Atlantic Canada. See where those regions are similar and perhaps where they differ when it comes to our findings. In the second half of today's presentation, I want to talk all about our virtual action weeks, as I said, specifically in Ontario and Atlantic Canada. In order to do that, the best way I think we can is to give you a glimpse of what those meetings actually look like. And so we've put together a series of clips from those meetings to highlight some of the comments, the feedback, and the conversation that we've had with elected officials in Ontario and Atlantic Canada over the last several months. It'll then be my pleasure to facilitate a conversation amongst the advocates who joined us for those meetings to hear some of their thoughts, their perspectives, and some of their takeaways from those meetings. Also, we're hoping to have a Q&A at the very end. You're welcome to ask me any questions. The panelists would also be happy to take any questions that you might have, so feel free to type those into the question window as we go along. So we'll start things off with a brief overview of the COVID-19 and Cancer Care Survey, which, as I said, has been a catalyst for our virtual action weeks all across Canada. For those who may not be aware, the COVID-19 and Cancer Care Survey has now been conducted 3 times nationally all across Canada. CCSN has partnered with Leger to produce and disseminate our COVID-19 and Cancer Care Survey all across Canada with thousands of respondents over the course of the pandemic, giving us a greater insight into the impact the pandemic has had on cancer patients and their families. There are several key takeaways from our surveying work that we've been doing over the last couple of years, but I've done my best just to highlight a few, and then we'll look and see how these results may differ when it comes to the Ontario and Atlantic Canada data sets. First and foremost, one of the major findings of our research over the last 2 years has been the fact that even as the pandemic has gone on, patients have continued to experience delays when it comes to accessing appointments and treatments. Now, this is a combination of factors whereby the healthcare system has put off healthcare services for patients, but also patients over the course of the pandemic have opted to put off their own care. Either way, this has meant delays in accessing services and perhaps in many cases, long wait times to reschedule healthcare services. Our second key finding focuses in on the impacts that these disruptions have had. And we found that disruptions in accessing care have had a major mental and emotional toll on cancer patients, but also their families over the course of the pandemic. We asked cancer patients and their caregivers to give us some insights as to what kind of impact these delays were having. And we heard comments about these delays impacting relationships at home, healthy routines at home, whether it's exercise, eating well, even their capacity to work both inside and outside of the home. So we know these disruptions have had a major impact and continue to have a major impact on the lives of the cancer community. Third, we've seen over the course of the pandemic, patients reporting an increase in in-person interactions. And we see this as a positive because based on the survey results that we've collected, in-person interaction with healthcare providers is slightly preferred to the virtual alternative. But it's worth highlighting that virtual consultations, be it over the phone or video virtual consultations with healthcare providers, continues to be the majority way in which patients are interacting with their healthcare teams. Number 4 is the fact that the majority of patients have been overall satisfied with the delivery of care over the course of the pandemic. We asked patients all across the country whether or not they were satisfied with care delivery, and the majority were. They highlighted things such as doctors being accessible as being a major factor for why they were satisfied. But of course, those who reported being unsatisfied with care highlighted exactly the opposite. So the availability, the accessibility of physicians and healthcare services is a major factor as to whether or not patients were satisfied with their care. And finally, the 5th key finding, and this is something that was specifically unique to our 3rd most recent survey that we completed. We asked questions about COVID-19 vaccination rates in the cancer community. And we did find a phenomenal result, which is the fact that cancer patients have a significantly higher vaccination rate than the general population, which not only represents the value of the COVID-19 vaccine, but the fact that cancer patients also recognize the impact that it's had in providing them not only physical health protection, but a degree of mental health support as well, allowing them to reintegrate in communities and meet with family and friends more regularly. One final note on that point is that barriers still exist when it comes to accessing vaccination, something I'll come back to in just a couple of moments. So let's break down these results very briefly across Atlantic Canada and Ontario, and this can serve as a little bit of a primer for what will be our discussion in a few minutes about the response of elected officials across these regions of Canada. So first, we know that patients are still incurring both voluntary and involuntary disruptions with care. And on the top of this slide, we see the percentage of patients in Atlantic Canada and Ontario who reported an involuntary disruption to a healthcare service. In both of these regions in Canada, it was 28%. So we can see that both Atlantic Canadians and Ontarians have had to deal with involuntary cancellations and delays in accessing healthcare services. An area of contrast between the two regions has been the percentage of those patients who chose to put off some form of healthcare service. We can see that Ontarian cancer patients in particular put off healthcare services at a much higher rate than their Atlantic Canadian counterparts. In Atlantic Canada, we found that 37% of patients reported postponing or canceling their own appointments or healthcare services, but nearly 60% in Ontario said the same. We understand that over the course of the pandemic, we have heard from cancer patients and their loved ones about the immense emotional toll that the pandemic has had. And one of the specific areas that the pandemic has impacted the mental health of cancer patients has been their anxiety and concern when it comes to their ability to receive care. We can see on this graph over the course of the pandemic how concern about accessing healthcare services has significantly fluctuated, as with each wave of the pandemic, there's been a spike in terms of anxiety when it comes to accessing healthcare services. On this slide, the green line represents the percentage of Ontario patients who suggested that they were very or somewhat concerned about their ability to access healthcare services, and the blue line represents Atlantic Canadian patients. What we can see over the course of the pandemic is that Atlantic Canadians have been consistently less concerned about their ability to access healthcare services than Ontario cancer patients. Now let's talk very briefly about how those interactions and access to services have looked for Atlantic Canadian and Ontario cancer patients. On the top half of this slide, I've broken down the percentage of patients in these regions who've reported a virtual interaction with a healthcare provider. Interestingly, again, we see a remarkable similarity that 83% of patients in Atlantic Canada and 85% of patients in Ontario reported a virtual interaction with their healthcare team. Where we can begin to discern a difference in the experience of these two cohorts has been their accessibility to in-person healthcare services. We find a difference in the fact that more Atlantic Canadian cancer patients reported in-person interactions with their healthcare providers than Ontario cancer patients did in our most recent survey. What's incredibly important beyond just the mode of care delivery is ultimately how satisfied Canadians have been, and specifically today we're focusing on Ontarians and Atlantic Canadians, how satisfied they have been with the quality of care they've received over the course of the pandemic. What we found is that Atlantic Canadians reported a higher degree of satisfaction with the quality of care received than those in Ontario. And last but not least, I want to touch on vaccination rates. This is something that we added to our most recent survey that was conducted just a few months ago that looked at what percentage of cancer patients across Canada had received at least one dose of the COVID-19 vaccine, and then as a follow-up, whether or not a second dose of the vaccine had been administered. What we found is that all across Canada, the vast majority of cancer patients that we spoke to either had received the COVID-19 vaccine or were intending to receive it. On this slide in particular, we can see the percentage of those who have received a COVID-19 vaccine. And if we look at the bottom half of the slide, we see Ontario and Atlantic Canada. In Ontario, 94% of the cancer patients that we surveyed reported receiving at least one dose of the COVID-19 vaccine. This is very similar to 91% of Atlantic Canadian cancer patients reporting the fact that they had received a dose of the vaccine. It's important to point out that these figures are significantly higher than the general population at that given time, which suggests that cancer patients have moved very quickly in ensuring that they can receive their COVID-19 vaccination as soon as possible for, as I mentioned earlier, both the physical and mental health reasons. Now, one area that we can very starkly differentiate Atlantic Canada and Ontario is in the percentage of patients who had received 2 doses of the COVID-19 vaccine at the time of completing our survey. In Ontario, just over half of the cancer patients who had been vaccinated had received 2 doses of the COVID-19 vaccine when completing our survey. That contrasts quite significantly to the Atlantic Canadian patients that we spoke to, whereas only 21% had received their 2nd dose of the COVID-19 vaccine when they were surveyed. Another important remark to make when it comes to COVID-19 vaccination, and this is something that I alluded to just a few moments ago, was some of the barriers that exist when it comes to vaccination for cancer patients. Included in our most recent survey, we asked patients whether or not they had any difficulties booking a COVID-19 vaccine appointment. And you'll notice that I've bolded Ontario and Atlantic Canada on this particular chart, with Ontario being a standout when it comes to such a significant percentage of cancer patients reporting having difficulties booking a vaccination appointment. 25%, that's 1 in 4 cancer patients that we spoke to in Ontario who had some difficulty booking a vaccine appointment. It's so important that we raised all of these issues, including difficulties booking vaccination, with the elected officials that we met with, because we know as booster doses of the COVID-19 vaccine become available, we need that process to be as seamless as possible. Cancer patients, according to our surveying, have demonstrated an incredible eagerness to obtain the COVID-19 vaccine, and governments across Canada need to do their part to make sure that that process is as seamless as possible. With that, I think I've given a really great primer and an overview of a lot of the information and the research that we've been able to produce and highlight to elected officials in Ontario and Atlantic Canada. And so with that, I want to move on to talk a little bit about the virtual action weeks themselves, give you a behind the scenes into some of the comments, feedback, and ultimately the interactions we've had with those elected officials. And then we're going to move on to our advocate panel, which I'm really looking forward to. We're going to hear directly from the advocates who joined us in these meetings to hear some of their thoughts and their feedback. So first and foremost, our opportunity to conduct virtual action weeks across Canada really began at the start of the pandemic, when all of a sudden meeting in person with elected officials wasn't a possibility. We quickly jumped on to the opportunity to meet virtually with elected officials all over the country. And this was one silver lining to our pandemic engagement and advocacy with all levels of government, because it gave us an opportunity to reach out to that many more elected officials without the additional cost of flying across the country. As a result, we were able to meet with dozens and dozens of elected officials and decision makers across Canada and focus specifically on the results of our COVID-19 and cancer care survey. It gave us the chance to amplify our message, ultimately build relationships, and improve our ability to advocate on behalf of the cancer community in the future. As I mentioned, these meetings took place virtually. They lasted about half an hour. They gave us a chance to present our latest research, and we included, as often as we could, a patient advocate within those calls to not only speak to their personal experience, but to reinforce the evidence that we've collected in surveying thousands of cancer patients from all across Canada. With that in mind, I thought I would just throw up a quick slide showing you just some of the names of the elected officials and decision makers across Ontario and Atlantic Canada that we've had an opportunity to meet with. You may recognize a couple of these names as an elected representative for your riding where you live in Canada, but we're really glad that all of these individuals took time out of their schedule to sit down with us and allow us to share our research and insights into the impact that the pandemic has had on cancer patients. Well, so far you've got to hear a lot from me and a lot from the Canadian Cancer Survivor Network about the important issues to us and the important advocacy work that we're doing. But I think now I'd like to turn it over to the MPPs and MLAs themselves. And so I've put together a brief video to show you some of the highlights from our meetings and give you a little bit of an idea, a flavor of the tone of those meetings, some of the stories that were shared. I hope you enjoy.
That it put on our cancer patients here. So what that sort of led me to do as MLA is we're actually working towards creating a cancer care center in our hospital. that to try to provide people to have chemotherapy treatments right here in our own area. We won't be able to do radiation because it's too, the capital costs are too great, but it's been, honestly, it's heartbreaking. So it was one day of disruption when there was the border blockade, but it came about because of the anger that people had after like 16 months of being ignored, even though they've been asked. But so I hear you. My mother passed away when I was 5. She had melanoma. She was only 28. So Jennifer, I understand the loss of your mom, and I don't really remember my mom, but I remember the nurses that took care of her, and it led me to go into nursing. So I studied to become a registered nurse right out of high school. And then my husband and I had 4 kids, and our 3rd son was diagnosed with a type of sarcoma when he was 16. But thankfully he survived, and he's a healthy 23-year-old. He's 6'7", plays varsity basketball. So he's so yeah, he's over at Mount St. Vincent actually. So so I'm with you. I thank you for all the work that you're doing and the awareness that you're creating and trying to get it out there on the agenda. I am also share your concerns about what the decrease in screening, what that is going to lead to, what the outcomes are going to be for that in the next 3 to 5 years, what we're going to be seeing for mortality rates.
What you shared with me happened in March and April last year. I would have felt like, well, let's give our healthcare system a bit of time. The pandemic is new, they will readdress. But it has been 18 months, and we're heading into a 4th wave where I think I looked at the stats, we had 350 people in our hospital with being admitted into our hospital because COVID had made them that sick. And really, we haven't seen a robust way to make it safe for everybody else who goes into our hospital. And if they are doing it, they're certainly not sharing that message with any of us, and certainly not sharing that message with people who are sick from their cancer right now and needing hospital care. I was kind of looking forward to your 3rd survey. In the back of my mind, I expected way better news than what you delivered today. But that just means that we need to roll up our sleeves and push this forward. Every patient who goes to every Ontarian who goes to a hospital should do so in a way that they feel safe. They feel that they're going there for care, they're going there to get better. And when such a high percentage of cancer patients tell us that they don't, I'm sort of disappointed that it has not stimulated a more robust response than what we have seen so far. So thank you for sharing that with me.
That's very valuable because I wasn't aware of the 3 sites. So I'll go back and kind of query where that is. And I mean, again, I sat at the cabinet table and lots of things got disrupted because of COVID and the realities, or sadly, the unrealities of what COVID was going to be. But certainly that type of thing, I can follow up with the minister and the ministry as well. So I do appreciate the update. I do appreciate you being able to provide that. And that's why I was asking some of the other points of clarification, Conrad, to make sure I was kind of up to speed and clear in what I was asking. So I do appreciate it. And again, happy to support wherever I can.
I'm very sympathetic to the situations that I was just listening to. My own experience, I lost my father to cancer almost 17 years ago, and my mother, we had the privilege of being able to have him pass at home. And actually, I have a sister that works in oncology. So we were in a really fortunate, if you can say that, situation in that. But my mother also went through cancer treatments just a few years ago. And so I understand how important it is to be in that caregiver situation, to be those ears in all of those meetings. And I don't know how familiar you are with me, but one of the statements that I have continually made throughout the COVID experience is that we cannot lose our humanity in all of this. So very sympathetic to people who are dealing or helping loved ones deal with cancer during COVID. I can't imagine. I honestly just cannot imagine having gone through what I've gone through with both of my parents, and then having COVID on top of it. So my compassion is certainly there.
So I always appreciate data. I think it makes our job a lot easier when we can, use research to back up the need for specific programs or interventions or funding or whatever. So really appreciate the work that the Canadian Cancer Survivor Network has done to sort of highlight some of these gaps and issues that need to be addressed. And I also have appreciated, I've attended back in the, a lifetime ago when we used to have receptions at Queen's Park. I had I appreciated the opportunity to meet with the Canadian Cancer Survivors Network and hear from survivors and have that dialogue. And so just want to thank you again for reaching out. And I look forward to continuing to work with you and to use the data that you're generating to get those improvements in place for cancer patients.
Materials that you provided, but I guess one of the things that that we've been urging the government to do is to have a plan with some meat on the bone around how to address some of the backlogs that we are seeing in the healthcare system. And so I don't know whether you have provided the government with specific recommendations or suggestions or benchmarks or asks, if you will, for getting through the backlogs that we have. But we're concerned that that this government seems to be a bit hands-off when it comes to proactive planning and getting things done in an urgent manner. And as Deborah's comments, I think, clearly indicate, it is a matter of life and death when it comes to people who are not getting timely diagnoses, particularly, nor timely treatment, but certainly folks that are folks that are not able to access timely diagnosis appointments and tests and things like that. Their outcomes, of course, are jeopardized in terms of possible treatment paths.
So I feel like we're in an even worse situation than we probably would have been if we were just fighting COVID on its own, but we're not. We're fighting a healthcare system in crisis as well. And so the more that we don't do the preventative screenings and get cancer treatments happening in an accelerated process, I feel like we are in a situation where we're going to lose people well before their time. And I know I did with my dad. And so it took a month for us to get another specialist, and my dad passed away before she came back from maternity leave. Not any fault of the physician that was doing maternity leave, but they couldn't replace her in time. And so she was able to come in a couple of days before my dad died, but it was already too late. So yes, I know this story, and any information, Conrad, that you can provide us to support, like, the survey, if you are able to provide us the full surveys, I would appreciate that.
About that since the middle of July and pushing the government on it. I was doing this recently just today, and I feel like a broken record. I just keep saying the same things, that it's just reasonable for families to expect that the person who's caring for their loved one in a hospital or home care or anywhere, that person's been vaccinated. It's a reasonable expectation, and we can get there. So if you look at it, Children's Hospital of Eastern Ontario, 99% vaccinated. Queensway Carleton Model, 98. UHN, 97. And so organizations that put the effort into doing it had success. They lost very few staff, and they're going to lose no staff to outbreak, which is really another reason to do it. So yeah, no, we're going to keep pushing for that. That's it's a concern that I can see that being especially a concern for immunocompromised. But it's like everybody, like 8 out of 10, maybe 8.5, like almost 9 out of 10 people want that. They agree with that. They got vaccinated. They don't want to be in a situation where they're compromised because somebody's unvaccinated, because they just choose not to. And so, yeah, I'm a broken record on that one, but you just got to live with this government on some things. You got to drag them screaming, kicking to do the thing that they need to do. Right? So send me any information you got, and I'll make sure I pass it right on directly to Ernie Hudson. He's the Minister of Health, and put it right in front of him, and then he'll see it too. So that's definitely it's interesting. You did a lot of information in your survey there. Like you covered a lot of bases and stuff like that. I was, of course, wondering how DEI was rating in Atlantic Canada, of course, specific, but I know it's hard to get down that far. But I know our vaccine rate and stuff like that is very high right now in both the first and the second. But I've never had that. It'd be interesting now. I want to have a conversation with my wife, Debbie, and say, have with what she knows about COVID, vaccines compared to people right within her wing of the hospital, right, would be interesting. Yeah. But no, thanks very much for reaching out, folks. I appreciate that.
We're going to be talking about quite a few things, not only cancer survivors, but there are others now that, I've got a vested interest in finding out how they've been impacted as well. And I'm wondering if it goes just from individuals with cancer, how are diabetes individuals now affected, how are heart individuals affected? Has there been a focus that has been given to a certain group for healthcare purposes? Have others been left aside? It just begs you to start asking those questions.
I hope that gave everyone a great sense of the kinds of meetings that we've had over the last several months. One thing that immediately stands out to me based on the clips we've put together is how many personal stories that were shared with us by the MPPs and MLAs from across Ontario and Atlantic Canada. Cancer truly does impact everyone. Everyone has a story. And so it was an amazing moment that many of these officials felt comfortable in sharing some very personal details about their experiences. We hope that the advocacy work that we've engaged with, bringing the latest information and surveying data from the cancer community directly to their hands, will ultimately mean that we can improve accessibility and the quality of care for cancer patients. Many of the elected officials had a lot of questions about seeing the entirety of our data set, and I can say that in many occasions there were follow-ups made, additional sources and details provided. This is something that I have spent the better part of almost 2 years working on. Has been incredibly meaningful work for me to engage in, and to do that alongside some phenomenal advocates. So it's now going to be my pleasure to orchestrate our brief advocate panel, joined by Andrea, Deborah, and Jennifer, to speak a little bit about their experiences in participating with CCSN in our virtual action weeks. I'm so glad that all of you ladies took the time out of your day to join us today. I can't thank you enough for all the time that you spent with me over the last several months. It's been incredibly generous of you, so thank you very much for that. I'll start with a question for Andrea. I would love to know, and I'm sure our audience would, was this your first time participating in a virtual action week with CCSN? And I'm also just curious what got you interested in participating?
Well, thanks, Conrad. It's not the first time. I participated in the virtual action weeks, I guess, last winter or spring. That CCSN organized as well. My first exposure to CCSN was attending, because I'm in Ottawa, a breakfast on Parliament Hill in the parliamentary dining room with MPs. focused on cancer-related issues that CCSN had organized. And that was my first chance to interact with MPs. And then later attended another breakfast a year later at the same time, and an event at Queen's Park, co-organized with Lung Cancer Canada, and then these virtual action weeks. So I've had quite a few opportunities to interact with our elected representatives, and you know, I think it's important to get the information to them because they can't act without this information. So it's important for me as a lung cancer patient to be a voice for other lung cancer patients, because there's such a need for more advocacy for our group in particular, but for all cancer patients.
Absolutely. And again, we really appreciate all the time you spent with us over the last several months. Deborah, I'd love to move on and ask you, having met with several MPPs from across Ontario, you were very generous with your time in meeting with us. One of the things we touched on, and I think it showed during our video clips, was that we met with elected officials across party lines. We met with officials in government, in opposition. And I wonder, do you feel as though our concerns were heard or even addressed over the course of our meetings?
I would probably say there were hit and misses. You know, there were definitely some connections. I think once the personal story was told, there was a deeper connection with some of them. But others, you know, I think just we're doing the party line, you know, and acknowledging, yet yes, there is an issue to be had, but at the same time, we're doing as much as we can. Don't ask for more. You know, I think there are a few officials, obviously, leader of the opposition here in this province, definitely wants the outreach, wants to know more. The ask of wanting to have the data sets, to get that information, was not always present in all of them, but definitely for the ones that did ask, that were really making sure that you were going to ensure that information got to them, I know are taking a deeper consideration into our asks and understanding that not only does it touch them personally, perhaps, but that they're actually able to see that we're not here trying to waste their time. We're here actually doing an authentic call for help. And, you know, I hope that it continues, you know, as we see what they will do in the next 6 months, probably.
Absolutely. And we're so glad that you've continued to work with us at CCSN and be part of our advocacy weeks. Jennifer, I know this was our first time, or say your first time joining CCSN in our virtual action week. So I wanted to jump back to the question I asked Andrea and just ask, you know, why you wanted to get involved. And as a brief follow-up to that, maybe what you would say to some others who are considering perhaps getting involved in advocacy work.
It was my first time, and I was very pleasantly surprised at how well organized you all were. Everything went off seamlessly for the most part, and that's hard to do when you're kind of coordinating schedules in different time zones and all of that. So I was thrilled to be asked to participate. I think that from a caregiver's perspective, it is important, so important to lend a voice to that population of people that are out there. And as you know, I spoke a lot to the fact that the COVID pandemic had such a huge impact on the caregivers of cancer patients. And it's important to me to encourage everyone out there to advocate for their own health and their own care and for those of their loved ones, because I have learned firsthand after the death of both of my parents that it's a necessity. You have to be able to advocate for your health and those of your loved ones. And I would encourage anyone out there to participate as much as they can, because I think that putting the personal connection and having that firsthand experiences makes a huge difference. I noticed in your video you had highlighted MLA Beaton from
Prince Edward Island, I believe, and that was one of the calls that I was on. And she was very, very emotional during that call because, and I know you all didn't know this at the time, but she actually had lost her father to cancer during the pandemic. So she had firsthand knowledge of everything that we were talking about, but it's just making that connection, that personal face. And I said a lot in our meetings that COVID didn't stop cancer, and I think that it's important. Just you got them on the video, you've got everybody there, so that's the first step. What they take from that, but at least you have them there for that attention. And advocating is so important, and I hope that everybody will take the opportunity to do that if they feel comfortable doing that. I don't mind public speaking, so it's okay for me. I know it's harder for some, but it's important.
Yeah, Jennifer, we really appreciated all the time that you put in to join us during our meetings. And of course, I'm sure the first few times you were nervous. I mean, Mike, I was so nervous the first few times I was doing meetings as well. But obviously, you've had an incredible impact in the meetings and sharing your story. Andrea, I'd love to turn back to you now and ask, Jennifer just mentioned a particular meeting that resonated with her. I was wondering, were there any moments, or a single or maybe a couple of moments over our virtual action week in Ontario that just resonated with you or stood out for some reason?
Well, I think certainly in many of the meetings that I had, people did, the MPPs or ministers that we met with did relate their own stories about their own personal experiences with cancer. Some were, at least one of the MPPs we met with was a cancer survivor himself, and others, of course, had mostly had experience with it directly in their own families. So, it's very personal to these people. They are people, and so it's a very personal issue for them as well. I think having the data, because some were very focused on the data, as you could see in the video. MPP Sattler was really thankful for having data to support her own advocacy as a member of the opposition, to press the government to do more. And I think that was true also of John Fraser, who's here in Ottawa and is a former parliamentary assistant for the Ministry of Health when the previous government was in power. Having the data that they can rely on was really important to them. Hearing personal stories about how it's impacted people, and then also being able to communicate to them. I think when there were real action items they could take away from the meeting, they really found that of value. So, for example, in the video was MPP Walker, and he was talking about following up, I think, on comments that I had made about rolling out lung cancer screening more broadly in Ontario, because it's just been made a permanent program, but they're still only operating in 4 pilot sites. And I was pressing for that as one of the things that could be done to address the issues that coming out of the pandemic and the need to get people back into the system.
Absolutely. Now, Deborah, I mean, that's a great point that Andrea's just made in terms of discussing the importance of specific asks, like ensuring screening services are available. I know one issue that we spoke a lot about during meetings that you participated in was the accessibility of vaccination issue.
Right.
And I wonder if you feel that we have really done enough there, and whether or not the government has all the information. Do you feel as though we've made some progress, I think is what I'm asking, in terms of the accessibility of COVID-19 vaccinations for immunocompromised populations like cancer patients?
Well, I think we did actually really reach a few of them to understand and give them the idea, posing the idea of a mobile unit that could be safely accessed by those of us that are immunocompromised made sense to them. We gave them an option that wasn't so far reaching. And I think we had probably 3 of them that were definitely like, this is something I can take back. This is an action item that I know I can use because it makes sense. And from a cost standpoint, we know it's not going to cost them a fortune to give us an option where we'll feel safe. You know, even with my own experience and having my elderly mother living with me, who is also at high risk, it struck a chord to understand it's not just about me. You know, similar to Jennifer, I'm in a caregiver situation often, and that is something that needs to be taken into consideration. It's not just about us as the patient, it's also who is around us in our home. And having that accessibility, I think, rang true. I know we had two, and I'm trying to remember the minister's name, that was just gung-ho. It was the best way to describe it. It was like, oh my gosh, that's like the best idea ever. It was actually quite a simple one to suggest a mobile unit. You know, it was kind of surprising, I think, sometimes that they hadn't thought of that. But at the same time, that does give credence to the fact that we are making a difference and giving them some ideas to really be able to take back and to be able to argue on our behalf.
Absolutely. Now, Jennifer, that's the Ontario perspective. We had some great meetings, and I think Deborah and I would both agree that we've formed some phenomenal momentum, passed along some great ideas, and had some really constructive conversations. How do you feel that the meetings you participated in Atlantic Canada went? Do you think that there was a real positive tone? Was there some progress that can be made there?
Yeah, absolutely. And I think that would be interesting to follow up and see what steps were taken out of the meetings, if we could, with those MLAs and members of parliament and whoever everyone was talking to, really across the country. I think in the Atlantic provinces that I was dealing with, New Brunswick, Nova Scotia, and PEI, we are geographically very close together, but in many other ways we're very, very different. And so for the perspective of down here, you know, when you're talking to someone from PEI versus New Brunswick versus Nova Scotia, it's all going to be very impactful in different ways. I think it was the same MLA that I was speaking about earlier, MLA Beaton, was talking about the fracturedness of the healthcare system there, and we all are to certain levels. But I think that at that point in time, we were talking to her, PEI was in a much dire position at that point. Yeah, I hope so. I hope it makes a difference, or else, you know, it would be kind of waste. But I don't think so. I think that most people were very receptive to taking that and seeing where it goes. So like I said, it'd be interesting if we could have some sort of follow-up to see what did come out of it.
And that's a big part of the ongoing efforts of the Canadian Cancer Survivor Network to engage with decision makers. This is not a conversation we want to end anytime soon. This is something that we want to continue to follow up on, to continue to raise, and to continue to advocate for cancer patients all across the country. We just have a few minutes left because I do want to see if we have any questions from the general audience. So I just have one question left. Same question I'd like to ask everyone, just for maybe a quick couple of thoughts. As I said, you were all so generous in giving of your time. You've met with so many MPPs and MLAs across Ontario and Atlantic Canada. So, you know, simply put, what's your outlook in your province? Andrea, I'll start with you again.
Well, a little bit mixed, I guess. I think that members of the government, that MPPs are well aware of the problems. I didn't feel in the meeting, so although one did mention being surprised at the stats, but I didn't feel like they were unaware of all these issues. I mean, they've clearly been made cognizant of it, and CCSN has done an excellent job in keeping them informed throughout the pandemic. I think they feel a bit, certainly the opposition MPPs feel a bit frustrated that they keep raising the concerns and not enough is being done. The government MPPs and certainly committed to pressing the issues, but I haven't seen any really significant movement on any of them since we had the meetings. And certainly there's lots of pressing priorities, but it would be nice to see more effort coming in to really address these issues and make sure the backlogs are cleared and people are getting the attention they deserve. And certainly those people who are the biggest group that I'm always been concerned about is those who aren't in the system yet. And we talked about that a lot in the meetings, that haven't received their diagnosis because they're afraid to go. They delayed getting the testing or the screening, and now are getting advanced diagnosed at a more advanced stage potentially, and then also having to face potentially delays then in surgery and treatment. I don't think treatment necessarily, but potentially still surgery. So I really think there's a big push that needs to be made to get people back into the system and comfortable getting back into the system. And I'm not really seeing that happening yet.
It's a really good point that you raised, and something that the Canadian Cancer Survivor Network is very aware of. As you mentioned, we talked a lot about it in our meetings in Ontario, are those pre-diagnosis patients, those who aren't in the system yet, and how important it is that we make sure that they have quick access to not only diagnostic tests, but then moving forward into various treatment options. Deborah, I'd love to ask you the same question. What is your outlook, based on our meetings in Ontario, what is your outlook for cancer care in the province? Oh, I think I may have lost my audio. Deborah, you're still there with us?
Are we there?
Oh, there we are.
Okay.
Sorry, I lost audio there for a second.
No worries.
I was just asking, based on your experiences and the meetings that we've had over the last several months in Ontario, what your outlook for cancer care in the province is.
Right, and I apologize because I thought you heard everything I just said. So, no, I was saying that I do agree with a lot of what Andrea said, and my big concern is that, we will still continue to see for the next couple of years those people who aren't in the system yet, who aren't being addressed, who are missing that opportunity to have the care they deserve. And we are such a large province here in Ontario. We know we have small pockets where they have never had any care in the last couple of years. And that worries me because while we have an election coming up, we don't know what's going to be the outcome of that. Will that be the possibility of shifting some gears where we see some change happen? Within the industry I work, I don't, I see the frustration of the opposition. I see that they are just, raising their hands going, come on, we've been trying. Hopefully there will be some change. But right now, I think my biggest concern is understanding those people who are sitting, waiting, wondering, and their outcomes may not be positive. And we need to really make sure that they are being taken care of. We also have a huge amount of new immigrants who are also challenged by language to understand exactly what's going on and whether or not they're actually getting into the system properly as well. You know, I think we have still a long ways to go to make sure that we are actually taking care of everyone. But I think, you know, as long as we're in the system, we're at least trackable in some manner. But I hope that there is improvements. Obviously, if we need to have boosters, if we need to have all of these things in place, that we are put as a priority, not as an afterthought.
Absolutely. Absolutely. And that's been a major theme of the advocacy work that we've engaged in. We're going to continue to engage in. In particular, as I said, these conversations are nowhere near done. This is an ongoing conversation that the Canadian Cancer Survivor Network wants to continue to have with elected officials all across Canada. And that includes in Atlantic Canada for that matter. So Jennifer, maybe you can provide us some of your thoughts in terms of what your outlook for cancer care in the province looks like.
Sure, and I will be quick because it's as simple as I have a lot of work to do. We have a lot of work to do in Nova Scotia, New Brunswick, and PEI. Hands down, we don't have centralized facilities or anything really like that. So we just have a lot to do. And this is a great, there's always, you know, being out there and getting out there is always great, but there's a lot more work to be done.
A very poignant way to wrap up our advocate panel. Again, thank you ladies so much, not only for your time today, but I can't stress enough to our audience how much time they've put into working alongside me and being part of our presentations to elected officials across Ontario and Atlantic Canada. So thank you so very much. It's been an absolute pleasure to work alongside you, and it's been CCSN's honor to include you in all of our work. So thank you very much again.
Thank you, Conrad.
With that, I will turn things over to Yeshua to see if we have any audience questions that we can wrap up briefly. Yeshua, I'll turn the Zoom floor over to you.
Awesome. We don't have any questions from the audience. You guys were very, very well spoken, and the questions were insightful, and the answers were even more so. So I think we will leave it there for today. Again, thank you so much for attending our webinar. And thank you, as Conrad said, to our panelists, Andrea, Deborah, and Jennifer, for a great and insightful conversation and all the work you do for the cancer community. This is the first in a three-part series of webinars that we'll be doing to close out 2021. And registration information for next week's webinar will be out soon. So watch your inboxes and social media feeds for that. A quick note about email. If you are not seeing our emails in your inbox, please check your spam or junk mail folders, as we use a third-party email service. So check your spam or junk for and mark CCSN emails as safe, or add us to your contact list to ensure they'll come straight to your inbox. As always, all of our previous webinars are accessible on demand through our website, and you can go to survivornet.ca/webinars to check those out. Thanks again for attending, and enjoy your day.